Hello and welcome to Cannabis Consumption Risk and Safety Practices course. I'm Jasmine Nguyen from the University of Maryland School of Pharmacy, Medical Cannabis and Therapeutics program. This course has three modules. Module 1, Risk associated with cannabis consumption. Module 2, Safety practices for cannabis consumption. And Module 3, Cannabis consumption tracker. Module 1, Risk associated with cannabis consumption. First, I will give a brief introduction. Then we will go over 10 potential benefits of consuming cannabis. Next, we'll go over the learning objectives for the entire course. Then we will go over what is cannabis and how is cannabis used. Then we will review all of that information. Then we will go over cannabis toxicity. And finally, we will go over specific risks associated with cannabis consumption. Welcome, student. You are embarking on a journey of knowledge and empowerment. Cannabis is a federally prohibited Schedule I substance under the Controlled Substances Act. For decades, over 70 years, the development of cannabis policy, cannabis products, and the new and emerging industry and market has been to the effort of those who need and use the plant and their advocates and allies. As a patient, caretaker, or adult consumer of cannabis, you too must embark on a journey of self-education and self-empowerment. The political landscape around the cannabis plant has left patients and consumers with little access to education about both the risk and safety precautions associated with cannabis consumption. This course is designed to arm the average patient, caretaker, and adult use consumer with awareness. Most people understand cannabis to be safe. Cannabis is safe. However, there are moderate to serious and life-threatening effects associated with the consumption of cannabis that the average consumer just is not aware of. This information is not to be used to navigate dosing or treatment of any condition or effect discussed in this course. The objective of this course is for the average patient, caretaker, and adult use consumer to develop a knowledge of the risk associated with cannabis consumption, to develop safe consumption habits, and gain an understanding of how tracking their own consumption can reduce risk and promote safe consumption. 10 potential benefits of consuming cannabis. Number 1, chronic pain relief. Compounds in cannabis, specifically THC, interact with your body's pain regulating system to help reduce chronic pain. Number 2, multiple sclerosis symptom management. Cannabis helps reduce muscle stiffness and pain in people with multiple sclerosis. Number 3, epilepsy treatment. CBD is effective in reducing seizures and specific epilepsy syndromes. Number 4, anxiety and sleep disorders. CBD may help reduce anxiety by affecting serotonin levels. THC has sedative properties and can aid sleep. Number 5, nausea and vomiting control. THC in cannabis helps reduce nausea and vomiting caused by chemotherapy. Number 6, appetite stimulation. THC can improve appetite. Cannabis has been used to improve appetite in HIV/AIDS patients. Number 7, reduction of inflammation. Inflammation is swelling, heat, or loss of function to a cell, part of body, tissue, or organ. Compounds in cannabis can help reduce inflammation in the body. Number 8, neuroprotection. Compounds in cannabis can protect nerve cells from damage. This can be helpful in treating and managing diseases such as Alzheimer's and Parkinson's. Number 9, harm reduction in substance abuse. Cannabis can help individuals reduce or quit more harmful substances, for example, opioids. Number 10, glaucoma management. THC can reduce eye pressure. This can be helpful in managing glaucoma. Learning objectives. Number 1, identify and describe the mental health risk, cardiovascular risk, respiratory or pulmonary risk, gastrointestinal effects and risk, neurological effects and risk, the risk of dependency and substance abuse, pregnancy-related risk, the risk associated with driving and motor function, and all other risks associated with cannabis consumption. Number 2, identify and describe the appropriate safety practices associated with specific risk associated with cannabis consumption. Number 3, the learner will record daily consumption patterns, routes of administration, frequency of consumption, times of consumption, dosage, etc. Number 4, learner will assess their level of risk for CUD, cannabinoid use disorder. How aware are you? What potential risk associated with cannabis consumption are you aware of? List at least 2 potential risks associated with cannabis consumption. I'll give you a few seconds. Now that you have those, as we move through this information, let's see if you can expand on or add to that information that you have. What is cannabis? This course covers topics on the consumption of cannabis, specifically the consumption of the flower of the cannabis plant and the products produced from the cannabis plant flower. In this course, cannabis consumption refers to the consumption of cannabis flower and cannabis products that contain the cannabinoids THC and CBD. THC, or delta 9 THC, delta 9 tetrahydrocannabinol, psychoactive cannabinoid, a natural compound found in cannabis, is responsible for the psychoactive effects of cannabis. The popular effects: euphoria, relaxation, altered perception, and cognitive effects, or effects on your thinking. CBD, cannabidiol, the non-psychoactive cannabinoid or natural compound found in cannabis, is responsible for mitigating or reducing or modulating the psychoactive effects of THC. CBD interacts with serotonin and opioid receptors to potentially reduce anxiety and inflammation. With regards to consumption, cannabis is classified into 3 categories based on its cannabinoid content, or based on its content of THC and CBD. 3 chemotypes. Chemotype 1, THC dominant, high THC content with a low CBD content. It produces substantial psychoactive effects and is associated with both medical and recreational use. It's typically used for pain relief, nausea, and appetite stimulation. Chemotype 2, it's a balance between both cannabinoids THC and CBD. It produces mild psychoactive effects and offers therapeutic benefits such as anxiety reduction and anti-inflammatory properties. It's used mostly medicinally. Chemotype 3 is CBD dominant. It has a high CBD content with the low THC content, and it has no psychoactive effects. It's typically used for medical applications such as epilepsy, inflammation, and anxiety disorders. How is cannabis used? In this course, we will focus on the risk of cannabis consumption and some safety practices and precautions to mitigate or reduce or avoid some of these risks. Next, we will briefly discuss how cannabis affects your body and how your body affects cannabis. That is, we will discuss the pharmacodynamics and the pharmacokinetics of cannabis. Pharmacodynamics is how a drug affects the body. That is the action of cannabis on your body. It's called the mechanisms of action. Pharmacokinetics is how the body processes a drug. It is the action of your body on cannabis. And how your body processes drugs is called ADME. That's absorption, distribution, metabolism, and excretion or elimination. Pharmacodynamics, how a drug affects the body. Action of cannabis on your body. THC interacts with your body by binding or connecting to cannabinoid receptors CB1 and CB2 in your endocannabinoid system, the ECS. The endocannabinoid system is a complex system in the body that works to help keep your body balanced. It maintains homeostasis. The ECS regulates functions such as immune response, appetites, pain, mood, and sleep, all to help maintain this balance, this homeostasis. The ECS is a biological system made up of endocannabinoids, cannabinoids, receptors, and enzymes. The ECS functions as a messaging system to maintain homeostasis. The endocannabinoid system. I'll briefly go over these three components of the ECS: endocannabinoids, cannabinoid receptors, and enzymes. So endocannabinoids are natural cannabis-like chemicals that are in your body. The body produces its own cannabinoids. These endocannabinoids or molecules send signals to aid in the balancing of different bodily functions. The cannabinoid receptors, CB1 and CB2, receive the messages from the interaction with the endocannabinoid. The cannabinoid receptors, CB1 and CB2, are the message receivers in the ECS. CB1 receptors are mostly located in the brain, and CB2 receptors are located in the immune systems or organs and peripheral tissues. CB1 receptors regulate mood, pain, and memory, and CB2 receptors control inflammation and immune response. And the enzymes simply break down the endocannabinoid or the cannabinoid that you put in yourself to prohibit it or stop it from continuing its act once its function has been completed. And now we will talk about the pharmacokinetics, and that is how your body processes a drug, the actions that your body takes on cannabis. And so how our body processes drugs is called ADME: absorption, distribution, metabolism, and excretion or elimination. Okay, so absorption is the A in ADME. Absorption is how cannabis enters the body. It's the process by which a drug enters the bloodstream. Absorption is related to how you consume or take cannabis. That is the route of administration or the method that you consume cannabis. Cannabis products come in many forms. Typically, cannabis is inhaled by burning the flowers of the plant, smoking, or using a vaping apparatus. However, cannabis can be inhaled and orally ingested or swallowed as candy, food, or beverages. Cannabis can also be administered on the skin or in other areas of the body. So let's take a side note for a second. Please consult your physician and speak to the director of your local state licensed dispensary or state licensed cannabis retailer to gather information on what cannabis products can best help you and to understand the various forms of cannabis medicine and products available in your jurisdiction. So let's go over routes of administration or different ways that you put cannabis into your body or how cannabis enters your body. So when inhaled, smoked, or vaped, cannabis is quickly absorbed through the lungs. The person who has inhaled, smoked, or vaped cannabis or a cannabis product will experience the effects within 3 to 10 minutes. Cannabis passes from your lungs to your bloodstream in 3 to 10 minutes when smoking or vaping. When orally ingested, cannabis must go through your digestive system. Cannabis is metabolized in the liver, and it goes through a process called first-pass metabolism. So metabolism is a process in the body utilized to break down and transform drugs into different substances. After metabolism, these substances or drugs become easier to use in the body or easier to eliminate or get rid of. A person who has orally ingested, swallowed, ate, drank cannabis will experience the effects in 30 to 60 minutes of consumption. Effects may last for up to 6 hours after consumption. When cannabis is administered through the sublingual, under the tongue, or rectal route, there is no first-pass metabolism. A person who consumes cannabis through the sublingual, under the tongue route will experience the effects within 4 hours of consumption. A person who consumes cannabis through the rectal route will experience the effects within 1 to 8 hours of consumption. When cannabis is administered through the topical route, On the skin, the time it takes to feel an effect varies. The effect of cannabis administered via the skin varies and depends on the formulation or potency of the product. Distribution: how cannabis spreads or moves through the body. Once cannabis enters your body, it travels through your bloodstream to other parts of your body, organs, tissue, brain, etc., and produces its effects. Note: THC is lipophilic. It's a fat-loving substance. THC is attracted to fatty tissues and accumulates in those fatty tissues. This can lead to prolonged effects. For example, prolonged psychoactive effects or the presence of cannabinoids in one's bloodstream after the effects, psychoactive or therapeutic, have ended. Meaning, prolonged psychoactive effects, you can experience the effects of consuming cannabis longer than typical, usual, or expected, right? Excessive. And the presence of cannabinoids in one's bloodstream is simply that you could test positive for cannabinoids weeks after you've consumed cannabis, even though you have not consumed cannabis since that, 4 weeks in that time period. Metabolism: how the body processes cannabis. Metabolism is a process in the body utilized to break down and transform drugs into different substances. We went over this briefly. These substances are easier to use in the body or easier to get rid from the body. THC is processed and metabolized in the liver. THC is broken down and transformed into another more potent substance, a metabolite. One of those metabolites, 11-hydroxy-THC, metabolite of interest. Although orally ingested, this is a note, cannabis must be processed or metabolized before the patient or adult use consumer experiences the effects. The intensity and duration of the effects are stronger and longer than the effects associated with inhaling cannabis, thanks to the metabolite or transformed substance, 11-hydroxy-THC. So, you consume cannabis, it's metabolized and processed when you ingest it. And that time period, that delayed onset, that period that you're waiting for it to be ingested, THC is transformed to many other forms, and the one of interest, the metabolite 11-hydroxy-THC, is transformed into a more potent form that's responsible for the extended effects associated with edible consumption. Elimination: how cannabis is eliminated from the body. After being processed or metabolized, THC and its byproducts, metabolite 11-hydroxy-THC, are eliminated from your body via your waste, urine, and feces. Note, as we said before, due to its fat-loving nature, lipophilic, and its tendency to store itself in fatty tissues, THC can remain in the body for days or weeks. And let's review this information very quickly. This course is designed to arm the average patient, caretaker, and adult use consumer with awareness. CBD is a non-psychoactive cannabinoid that is effective in reducing seizures and specific epilepsy conditions. THC interacts with your body's pain-regulating system to help reduce chronic pain. THC in cannabis helps reduce nausea and vomiting caused by chemotherapy. A cannabinoid is a natural compound found in cannabis. THC delta 9-THC is a psychoactive cannabinoid. CBD is a non-psychoactive cannabinoid. Cannabis has 3 chemotypes, divided into 3 categories for consumption that are based on the balance of the 2 cannabinoids, CBD and THC. Pharmacodynamics is how a drug affects the body. It is the action of cannabis on your body. Pharmacokinetics is how the body processes a drug. It is the action of your body on cannabis. The ECS, endocannabinoid system, is a complex system in the body that works to help keep your body balanced. Cannabis toxicity. Cannabis toxicity occurs when consuming cannabis has harmful effects on the body and mind. Cannabis toxicity can show up as short-term issues, that's acute cannabis toxicity, or as long-term issues, that's chronic cannabis toxicity. Chronic toxicity, cannabis toxicity in adults is uncommon. However, cannabis toxicity does occur and can occur after a single use. Children are the group most vulnerable to cannabis toxicity. Factors leading to cannabis toxicity. Greater than intended dose or high dose. When consuming edibles or cannabis products that you orally ingest, swallow, eat, or drink, you do not experience effects until at least 30 minutes after ingestion. Repeating your dose or taking more cannabis before you experience the effects of your first dose leads to a high dose or a greater than intended dose. Consuming concentrated THC products may increase the risk of experiencing toxic effects. And misunderstanding the dosing instructions for a cannabis product can lead to a greater than intended dose and potential toxic effects. Unintentional use or accidental ingestion. Unintentional use or accidental ingestion occurs when adults or children mistake an unlabeled cannabis product for a non-cannabis food item. Children are at higher risk for cannabis toxicity. Children have lower body weights compared to adults, and they are still developing physically and psychologically. And here's a list of some symptoms of acute cannabis toxicity in adults. And we won't review them all, but there's agitation, there's tachycardia and hypertension, which is a racing heart and elevated blood pressure. There's lack of muscle coordination, delirium, slow breathing. It's a number of symptoms associated with acute cannabis toxicity. How does chronic cannabis toxicity occur? Consuming large amounts of high THC potent cannabis or cannabis products leads to uncomfortable and potentially harmful outcomes or effects. Chronic cannabis toxicity can affect your mental health, cause breathing issues, heart health or cardiovascular risk, issues with memory and thinking or cognition, and stomach or gastrointestinal issues. Cannabis intoxication must be treated in the appropriate setting by medical professionals. If you suspect that you or someone you know may be experiencing cannabis intoxication, please contact 911 and the local poison control center. Meeting toxic levels of cannabis usually involves high doses of THC. Meeting toxic cannabis levels also involves how you consume the cannabis or the route of administration, eating or ingesting edibles or inhaling or vaporizing concentrated THC products. Consuming edibles. When you consume edibles or ingest cannabis, there's a 30 to 60 minute delay in experiencing the effects. We've discussed that. Some patients or adult use consumers have and may ingest more cannabis while waiting on the effects of their first dose. Due to this delayed onset of effects, edible cannabis products are associated with a greater risk of chronic cannabis toxicity. High potency products. Consuming high potency cannabis products or products with an elevated THC concentration can lead to chronic cannabis toxicity when consumed in large amounts. That brings us to specific risks of cannabis consumption. Section 1, mental health risk. Section 2, physical health risk. Section 3, dependency and substance abuse. Section 4, pregnancy-related risk. And Section 5, driving impairment. Section 1, mental health risk. Psychosis, anxiety, depression, and cognitive impairment. Cannabis can induce psychiatric symptoms. Cannabis use can lead to the experience of psychiatric symptoms. Research has identified an association between cannabis use and the onset of psychiatric symptoms. And not only can cannabis induce psychiatric symptoms, some symptoms of psychiatric disorders may be exacerbated or made worse by cannabis use. Measuring and understanding the adverse effects of cannabis is complicated. The adverse or harmful effects and non-adverse effects of cannabis consumption are both objective and subjective. There are changes in the body and the brain of a person who has consumed cannabis, and these changes can be observed by others. Objective. A person who has consumed cannabis also has a personal, individual experience of the effects that only they can describe. This experience cannot be measured, only described by the individual. Subjective. The effects of cannabis vary by individual. The adverse effects of cannabis also vary by individual or appear differently and feel differently in each person. There are other factors such as the strain or variety of cannabis, the type of cannabis or product or route of administration, the dosage, and the patient or adult use consumer's experience with cannabis or their tolerance level of cannabis also play a role in both the subjective and objective effects of cannabis. So evidence suggests that frequent use of high potency THC containing cannabis and cannabis products is associated with an increased risk of psychosis or psychotic disorders. Studies report that individuals who have ever used cannabis have a greater chance of developing psychosis compared to individuals who have never used cannabis. Cannabis use increases the risk of schizophrenia. Studies report that THC may be the primary agent in cannabis that fosters the onset of exacerbation or worsening of schizophrenia. Cannabis use also increases the risk of psychosis. But for a person who has blood relatives with psychosis or schizophrenia, or a person who is genetically vulnerable, those risks increase. Consuming high potency THC increases the risk of psychosis and schizophrenia. Consuming cannabis or exposure to cannabis at a younger age increases the risk of psychosis and schizophrenia. The potency of cannabis and the frequency of cannabis use are driving factors in the potential development of psychotic symptoms. So, high potency THC and frequent cannabis use really, seriously, based on evidence, can influence the development of psychotic symptoms. And here's a brief definition and description of schizophrenia and psychosis and their symptoms. So, psychosis is a disconnection from reality displayed with disorganized thinking, hallucinations, and delusions. That is a disconnection from reality displayed with disorganized thinking, hallucinations, and delusions. Schizophrenia is a brain disease, a chronic and severe mental disorder. And so you can take the time to review the descriptions of the symptoms on your own. I'm going to move on. Anxiety disorders. Anxiety symptoms manifest in multiple disorders. General anxiety disorder, social phobia, that's social anxiety disorder, or panic disorder. And the treatment varies depending on the diagnosis. Cannabis use and anxiety is also complicated. The cannabinoids THC and CBD have differing effects on anxiety. THC is reported to both induce anxiety, that is, encourage or create anxiety, and lessen anxiety depending on the dosage. And CBD is reported to reduce anxiety at any dosage. Regular cannabis use is associated with an increased risk of anxiety symptoms. Studies have found it unclear if cannabis use leads to anxiety disorders or if individuals with anxiety disorders are more likely to self-medicate with cannabis. Cannabis use is associated with an increased risk of developing social anxiety disorder with regular use. Mood disorders, depression, and bipolar disorder. Mood disorders are a category of mental health conditions. Individuals with mood disorders experience disturbances in their emotional state that lead to periods of intense sadness, depression, or extreme elevated moods, mania. Depression or major depressive disorder and bipolar disorder are the two most common mood disorders. And here are two descriptions of the symptoms. and the definition of major depressive disorder and bipolar disorder, and you can review that at your own pace. Cannabis use and mood disorders are also complicated. Regular or frequent cannabis use is associated with an increased risk of depression symptoms. However, cannabis use does not cause depression symptoms. There is an increased risk for suicidal ideation or attempts and suicide completion. This risk increases with use, meaning chronic users have a higher risk of suicidal ideation, suicidal attempts, and suicide completion. Near daily cannabis use may be linked to increased symptoms of bipolar disorder in persons diagnosed with bipolar disorder, meaning people who have bipolar may exacerbate or make worse their bipolar symptoms if they consume cannabis daily or near daily. Cognitive impairment. Cognitive impairment refers to difficulties with certain mental abilities, problem solving, language, attention, and memory. Cognitive impairment can occur for several different reasons: substance use, mental illness, brain injuries, and neurological disorders. Chronic, frequent, and regular cannabis use over a span of a lifetime may have long-term impacts on cognitive function. Chronic cannabis use is associated with diminished or a reduced cognitive performance. And that concludes the section on mental health risk. Now we will do a quiz together. So I'll give you a few moments to look over questions 1 through 5, and then we'll go over them together. Number 1, cannabis use can induce psychotic symptoms or lead to the experience of psychiatric symptoms. True or false? True. Number 2, chronic, frequent and regular cannabis use over a span of a lifetime may have long-term impacts on brain function. True or false? True. Frequent use of high-potency THC cannabis or cannabis products is associated with an increased risk of psychosis or psychotic disorders. True or false? True. Cannabis use can increase the risk of schizophrenia in individuals who are genetically vulnerable or has parents or close relatives with schizophrenia. True or false? True. Number 5, choose the correct term for the following description: a disconnection from reality associated with disorganized thinking, hallucinations, and delusions. Schizophrenia, depression, psychosis, or stress. Psychosis. And I'll give you a few seconds to review questions 6 through 10. Number 6, THC is reported to both induce and reduce anxiety. True or false? True. Number 7, CBD is reported to reduce anxiety. True or false? True. Number 8, regular cannabis use is associated with an increased risk of anxiety symptoms. True or false? True. Number 9, chronic cannabis users have a higher risk for suicide attempts and suicide completion. True or false? True. Number 10, for persons diagnosed with bipolar disorder, near daily cannabis use may be linked to increased symptoms of bipolar disorder. True or false? True. Section 2, physical health risk: cardiovascular risk, pulmonary risk, respiratory risk, and neurological, gastrointestinal, and other risk. The cardiovascular system consists of the heart, blood vessels, and blood. It supports immune system function through the circulation of white blood cells. It removes waste, delivers oxygen and nutrients to keep cells healthy and alive, and helps to regulate the body's temperature and pH balance. Cardiovascular health is the health of the heart and blood vessels. The interaction between cannabis use and cardiovascular health is also complex. There are both immediate, acute, and long-term, chronic cardiovascular effects associated with cannabis use. Acute effects happen right around the time of consumption. Chronic effects happen from repeated consumption. Some patients or adult use consumers may consume cannabis without any issues. Patients with potential or existing heart conditions must be aware and cautious when consuming cannabis. If you are a patient or adult use consumer who suffers from a heart condition, please consult your physician on your consumption. Ask your physician to provide research on the most safe and appropriate way for you to consume cannabis. You can also request this information from the director of your local state licensed dispensary. Cannabis acutely, immediately stimulates the cardiovascular system. Acute cardiovascular effects are the immediate physical responses of an individual who has just consumed cannabis. THC can cause immediate increases in heart rate and increases in blood pressure. Tolerance, an individual's ability to consume cannabis without some of the side effects or with reduced adverse effects. Tolerance is built over time. Tolerance is due to the amount of exposure, repeated consumption. Tolerance to cannabis can develop quickly, 1 to 2 days, with repeated use. So regular cannabis use can mitigate or reduce, eliminate some acute cardiovascular effects. Immediately following cannabis use, an individual's risk of heart attack is increased. Cannabis is linked to a higher short-term acute risk of heart attack. The risk of a heart attack is several times greater within the hour of smoking cannabis. 4 key acute cardiovascular effects of cannabis consumption. And you can review this chart at your pace, but the 4 acute cardiovascular effects of interest are heart rate increase, irregular heart rhythm, heart attack, and stroke. So heart rate increase is very common. Irregular heart rate rhythm is very uncommon. Heart attack is also very uncommon, and stroke is very uncommon. So cannabis use can cause the heart to beat in a regular rhythm. Out of 2.46 million cannabis patients or adult use consumers, 66,000 or 3% have experienced irregular heart rhythm. Immediately following cannabis use or 1 hour after use, an individual's risk of heart attack is increased. It's very uncommon, however. Cannabis triggers a very small percent of heart attacks, but it is possible. Out of 3,882 patients, 1% use cannabis within 1 hour of the onset of their heart attack. And strokes are very uncommon. People who use cannabis are 3.3 times more likely to have a stroke than non-cannabis users. And there's one more uncommon acute effect of interest called cannabis arteritis. It's a vascular event. It's the inflammation of the small arteries. It's extremely rare, and it leads to reduced blood flow, and it's specific to young, heavy cannabis smokers who consume cannabis along with tobacco. The acute cardiovascular effects of cannabis consumption commonly occur or happen, but occasionally have serious results or outcomes. Let's look at a description of acute cardiovascular effects in cannabis consumption. To better understand how cannabis can trigger acute cardiovascular effects, imagine your heart is a car engine. Your car engine, heart, runs steadily and smoothly or optimally when you are relaxed. Imagine yourself suddenly hitting the gas or revving the engine, your heart. What happens to the car engine? Your heart. For patients who have hidden issues or issues with their heart engine, the THC content in cannabis tells the body to hit the gas pedal too hard, requiring sudden extra work that puts a strain on the heart engine. This can cause the heart to fail from not receiving enough oxygen, a heart attack. Now let's look at a real-world example of the possible adverse acute cardiovascular effects associated with cannabis consumption. A 27-year-old middle-aged person who is unaware they have heart disease smokes cannabis with a high THC content. Immediately after consumption, they experience chest pain and struggle to breathe because their heart is working too hard. This person ends up in the emergency room suffering from a heart attack. Chronic cardiovascular effects of cannabis are the health impacts that develop over time from long-term or habitual cannabis consumption. The chronic cardiovascular effects of cannabis consumption may arise from overall exposure of the cardiovascular system to cannabis smoke toxins, the effects of THC, and other lifestyle factors related to continuous cannabis consumption. These effects include the development of cardiovascular disease and lasting changes in cardiovascular functioning. Chronic cannabis smoking exposes cannabis consumers to harmful combustion products that are known to damage blood vessels over time and promote vascular inflammation. Long-term cannabis consumption is associated with increased rates of cardiovascular disease. Habitual users have greater odds of heart attacks, strokes, and heart failure. Chronic cannabis (THC) consumption, daily, frequent, or repeat use or use over time, leads to a 25% greater chance of a heart attack and a 42% greater chance of a stroke than non-cannabis users. Chronic cannabis THC consumption can lead to effects or interactions in the endocannabinoid system that result in vasospasm. Patients or adult users with certain existing risk factors, i.e. chronic cardiovascular disease, are more likely to have stroke. 4 key chronic cardiovascular effects of cannabis consumption. Again, you can review this table at your own pace, but the 4 key chronic cardiovascular effects of cannabis consumption of interest here are long-term heart disease risk, stroke risk, heart failure, and cardiomyopathy, and hypertension and other risk factors. Long-term heart disease risk is uncommon, stroke is uncommon, heart failure is rare, and hypertension is also uncommon. Extreme cardiovascular outcomes may be rare or uncommon. However, in uncommon cases, prolonged cannabis use leads to serious cardiomuscle damage. Cannabis use typically begins in young adulthood, so chronic outcomes such as heart attacks and strokes don't show up until many years after the start of cannabis use. Chronic cannabis use is related to a gradual increase of cardiovascular risk over time. The chronic cardiovascular effects of cannabis consumption can be indicated by cannabis smoke alone. Cannabis alone can contribute to cardiovascular risk. Respiratory effects. The respiratory system is responsible for airflow. It is how we breathe. It includes our lungs, nose, throat, and windpipe. Chronic cannabis smoking is associated with airway injury. Airway injury can increase the risk of respiratory infections. Damaged airways affect the lungs' natural defense system, making it easier to develop an infection. Chronic bronchitis. Smoke irritates and inflames your airways. This leads to chronic bronchitis, the development of a long-lasting cough, the production of more mucus, and the experience of wheezing. Symptoms of chronic bronchitis are more likely to be reported by cannabis users than non-cannabis users. The symptoms of chronic bronchitis improves when the individual stops smoking or consuming cannabis. Current research has not found support to suggest that cannabis smoking can cause cancer. Smoking cannabis regularly can lead to respiratory symptoms like respiratory symptoms observed in tobacco smokers. However, the link between cancer and cannabis has not been made by researchers. Smoking cannabis can lead to inflammation of the airways and other respiratory infections. Smoking cannabis, like smoking tobacco, allows cancer-causing substances into the body. The adverse effects of cannabis smoking are not comparable to the harmful effects of tobacco smoke. Pulmonary effects. The lungs are essential organs within your respiratory system. The main functions of your lungs are to deliver oxygen to the bloodstream and remove carbon dioxide from the body. Smoking cannabis regularly can affect your lungs in several different ways or lead to respiratory symptoms and diseases or changes in lung function. Long-term heavy cannabis use over time can make it harder to breathe deeply. Chronic cannabis use may cause your airways to become narrower. This makes your ability to breathe less efficient. Cannabis users may show increased lung volumes and airway resistance. However, these changes are less severe than the changes seen in heavy tobacco smokers. Risk of chronic pulmonary disease, COPD. There's evidence that heavy long-term cannabis smoking may increase the risk of developing COPD. COPD is a group of lung diseases that block airflow and make it difficult to breathe. There is some evidence to support a potential increase in COPD risk for heavy cannabis users. However, the existing research does not support a cause and effect relationship between cannabis consumption and COPD. Neurological, gastrointestinal, and other risk. The nervous system is made of the brain, spinal cord, and peripheral nerves. Neurological effects of cannabis consumption are complex. There are potential adverse effects associated with cannabis consumption, and there are neurological benefits of consuming cannabis. Adverse or harmful effects. Cognitive impairments. There is evidence that links chronic cannabis use to deficits in attention, memory, and executive functions. Regular cannabis consumption can lead to problems with decision-making, memory, and concentration. Increased higher risk of stroke. There is evidence that links cannabis consumption with a higher risk of stroke. The risk increases with the intensity of use. Heavier users and individuals who consume tobacco and cannabis together have higher risk of having a stroke. Psychiatric disorders or mental health issues. Heavy cannabis use in adolescents or teenagers has been linked to mental health issues such as psychosis and mood swings. Beneficial effects. Help with seizure reduction. CBD has been effective in reducing seizures in specific epilepsy conditions such as Dravet syndrome and Lennox-Gastaut syndrome. Easing muscle stiffness and multiple sclerosis. Cannabis-based medicines are effective in managing or relieving muscle stiffness and pain in people with MS. Gastrointestinal risk. The gastrointestinal tract, GI tract, is the body's pathway for food to enter and exit the body. Adverse effects. Chronic toxicity. Cannabinoid hyperemesis syndrome, CHS, is a severe nausea and vomiting syndrome. Some long-term heavy cannabis users experience bouts, recurring episodes, or cycles of intense nausea, vomiting, and abdominal pain. Individuals suffering from cannabinoid hyperemesis syndrome consume cannabis typically daily and usually engage in years of heavy usage. Why does cannabinoid hyperemesis syndrome occur? Studies have found the cause of hyperemesis syndrome to be unclear. Some scientists speculate that cannabinoid hyperemesis syndrome occurs because chronic exposure to cannabis may disrupt your ECS or endocannabinoid system. Individuals suffering from CHS may find relief from hot showers. However, it has been shown the only way to relieve the symptoms of CHS is to stop cannabis consumption. CHS is often underreported, and individuals suffering from CHS often go undiagnosed. One study found that 32.9% of patients who reported using cannabis in the last 20 days met the criteria or diagnosis for CHS. CHS is most prevalent in adults ages 18 to 39. It's estimated to be prevalent in 1% of the U.S. population. 32% of individuals diagnosed with cannabis use disorder have CHS. CHS symptoms typically show up after an average of 6 years of heavy cannabis consumption, and CHS is more prevalent in males. Other risk: secondhand smoke exposure and pediatric exposure. Secondhand cannabis smoke has the potential to cause irritation and lung problems in non-smokers. The rising availability of edible cannabis and THC products may be associated with pediatric exposure. Pediatric exposure is accidental ingestion of an edible, cannabis, medicine, or cannabis product by a child. This exposure can produce harmful or toxic effects. EVALI, e-cigarette or vaping product use associated lung injury. EVALI is an acute respiratory illness linked to the use of e-cigarette or vaping products. It's typically reported among adults aged 35 to 39. It was first noted in 2019. The illness since then has occurred less, however, it still remains a concern. A significant amount of individuals who experience EVALI reported vaping cannabinoids. The symptoms include shortness of breath, coughing, chest pain, nausea, vomiting, and diarrhea. Drug and food interactions with cannabis. Cannabis, specifically THC and CBD, can interact with different substances, leading to potential adverse or harmful effects. Using cannabis with certain medications can lead to adverse or harmful interactions. Blood thinners. Consuming cannabis and taking blood thinners together can increase the risk of serious bleeding. Opioid treatments. Consuming cannabis and taking medications for opioid use addiction may increase side effects and produce difficulties breathing. Immune system suppressants. Consuming cannabis with drugs that suppress the immune system increases the chances of drug toxicity or harmful effects. There is no evidence of any specific food having an adverse harmful effect when paired with cannabis. And that concludes the section on physical health risk. Now we will go over the physical health risk quiz together. I'll give you a few seconds to review questions 1 through 7. Number 1. The cardiovascular system consists of veins, blood vessels, heart, lungs, blood, brain. The cardiovascular system consists of blood vessels, heart, and blood. Number 2. Cardiovascular health is the health of the heart and the blood vessels. True or false? True. Number 3. These cardiovascular effects happen right around the time of consumption. Acute effects or chronic effects? Acute cardiovascular effects happen right around the time of consumption. Number 4. THC can cause increases in heart rate and increases in blood pressure. True or false? True. Number 5. Cannabis is linked to a higher short-term risk of heart attack. True or false? True. Number 6. The risk of a heart attack is several times greater within the hour of smoking cannabis. True or false? True. Number 7. Cannabis consumption results in a 20% to 30% heart rate increase immediately after use. That lasts for 2 to 3 hours. Is this effect very common? Yes or no? Yes. Cannabis consumption results in an increased heart rate, and it is a very common effect of cannabis consumption. I'll give you a few seconds to review questions 8 through 13. Number 8. Heart rate increase, irregular heart rate rhythm, heart attack, and stroke are 4 key acute cardiovascular effects of cannabis consumption. True or false? True. Number 9. Cardiovascular effects of cannabis that impact health and develop over time from long-term habitual cannabis consumption. Acute effects or chronic effects? Chronic cardiovascular effects. Chronic effects. Chronic cardiovascular effects of cannabis impact health and develop over time from long-term habitual cannabis consumption. Number 10. Chronic cannabis, THC consumption, daily, frequent, or repeat use over time can lead to effects or interactions in the endocannabinoid system that result in vasospasm. Chronic, true or false? True. Number 11. Chronic vasospasm leads to heart attacks. True or false? True. Number 12. Long-term heart disease risk is a chronic cardiovascular effect of cannabis consumption. True or false? True. Number 13. The respiratory system is responsible for airflow. It is how we breathe. True or false? True. I'll give you a few seconds to review questions 14 through 18. Number 14. Smoke irritates and inflames your airways. This leads to chronic bronchitis. True or false? True. Number 15. Chronic bronchitis is the development of a long-lasting cough, the production of more mucus, and the experience of wheezing. True or false? True. The lungs are essential organs within your respiratory system that function to deliver oxygen to the bloodstream and remove carbon dioxide from the body. True or false? True. Number 17. Smoking cannabis regularly can affect your lungs in various ways or lead to respiratory symptoms and diseases or changes in lung functioning. True or false? True. Number 18. COPD is a group of lung diseases that block airflow and make it difficult to breathe. True or false? True. I will give you a few seconds to review questions 19 through 25, and that will conclude the physical health risk quiz. Number 19. There are potential adverse effects associated with cannabis consumption, and there are neurological benefits of consuming cannabis. True or false? True. Number 20. CHS, cannabinoid hyperemesis syndrome, is an abnormal sign that indicates chronic cannabis toxicity. True or false? True. CHS affects the gastrointestinal tract, the heart, the brain, or the lungs. CHS affects the gastrointestinal tract. Number 22. Individuals suffering from CHS experience cycles of intense nausea, vomiting, and abdominal pain. True or false? True. Number 23. Secondhand smoke and pediatric exposure are other risks associated with cannabis consumption. True or false? True. Number 24. EVALI means e-cigarette or vaping product use associated lung injury. True or false? True. Number 25. Taking these medications with cannabis can lead to adverse or harmful interactions or effects. Blood thinners, opioid treatments, immune system suppressants. Yes, all 3 medications have adverse or harmful interactions with cannabis: blood thinners, opioid treatments, and immune system suppressants. Dependency and substance abuse. We will review components of addiction, rewards, tolerance, dependency, withdrawal, and cannabis use disorder. Imagine that your friend brings you exotic, rare chocolates that have effects that energize you and make you feel happy and good. You love this chocolate. It helps you to relieve stress and relax. At first, you would eat one piece on the weekend. After 3 weeks of enjoying your chocolate bliss on the weekend, it wasn't enough. You wanted to carry that weekend chocolate joy through your week. So you begin to have chocolate at lunch and on the weekend. A month goes by, and now you have a piece of chocolate with your coffee, lunch, and on the weekend. 2 months have gone by, and every time you feel frustrated, you have a piece of chocolate in addition to the chocolate that you have with coffee, at lunch, and on the weekends. You have not seen your friend for a while. You have not been able to get the special chocolate for a week, and you are just not functioning the same. None of your usual activities help you with your mood. You cannot find joy like you did when you were enjoying your chocolates, and you can barely manage your temper. On your walk home, you think you see your friend's car at a stoplight a few blocks over. You rush into traffic, ignoring the stoplights, and in an attempt to flag your friend down for more chocolates, you cause a fender bender and almost get hit. This scenario describes the components of addiction and how a person may develop an addiction. Chocolate was used in this scenario as a potentially addictive substance to give a simple explanation. However, the components of addiction have more serious outcomes when dealing with other substances. In the chocolate scenario, after eating or being exposed to the special chocolate and its effects, rewards, you wanted more chocolate to continue experiencing the rewards. Your brain found the effects of the chocolate pleasurable and rewarding. Continuing to eat the chocolate led you to building a tolerance to the effects of the chocolate. Your brain adjusted to the rewards and needed more chocolate to produce the feeling or effect or reward each time you ate the chocolate. As you increase the amount of chocolate you ate to get the feeling or effect or reward of joy, happiness, and relaxation, your brain begins to associate those things with the chocolate, and now you need the chocolate to feel happy, relaxed, or feel joy. Your brain chemistry has changed. The rewards associated with the chocolate and the continued consumption of the chocolate has caused your brain to become dependent on the chocolate to experience joy and relaxation. You experienced symptoms of withdrawal when you could no longer gain access to the chocolate. Your brain functioning was altered. You were agitated and you caused an accident and put yourself in danger, seeking the chocolate in attempts to satisfy your craving or withdrawal symptom. A very simple definition of addiction is compulsive or uncontrollable drug use or drug abuse, even though there are harmful consequences. Addiction can be viewed as a disorder of the brain's reward system. Our brains have a built-in reward system that rewards behavior that supports survival. The reward is a release of chemicals in the body that make you feel good. The reward system releases natural chemicals in our body, for example, dopamine, when we engage in behaviors that are good for us. In other words, our brains make us feel good when we take actions that are associated with surviving, for example, eating and socializing. Substances or drugs can hijack this system and cause addiction. Addiction occurs when substances interact with our brain's pleasure system or reward system by forcing the release of the chemicals and forcing an association of the use of the substance with pleasure, rewards, or survival. The purpose of the brain's reward system or pleasure system is to boost and support survival behaviors. In addiction or substance use disorder or cannabis use disorder, an individual has taken a substance that overrides the brain's reward system. The substance takes over the reward system or hijacks the reward system, causing the brain to reinforce or support or boost the behaviors associated with taking and getting that substance. Tolerance. Repeated exposure to a substance reduces its effects and leads to an increase in dosage to get the same effect that a smaller dosage used to achieve. Over time, your body adjusts to or gets used to a drug. The same amount of a drug does not have the same effect over time. A person must take more of a substance to feel its effects. Tolerance occurs when your body responds differently to a substance over time. Your body adjusts to the substance. Your brain becomes less sensitive to a substance and begins to require more of the substance to produce the same effects. Dependency. When your brain or body has adjusted to taking a substance, your brain or body has become dependent on the substance to function normally. Developing dependency to a substance leads to withdrawal symptoms. To stop taking a substance that you have developed a dependency to means that you will not function normally without the substance. Withdrawal is a set of physical and mental responses, symptoms that occur when chronic use of a substance is stopped or reduced. Withdrawal symptoms are the brain's efforts to restore balance or homeostasis in the body in the absence of the substance that the body has become dependent on. Your body has adjusted to a substance, and when it's removed, you can feel a number of different symptoms such as mood swings, sleep issues, and changes in your appetite. The National Institute of Drug Abuse and American Society of Addiction Medicine define addiction as a chronic medical disease. Addiction is a treatable, preventable disease. Individuals suffering from addiction can recover or get better. Addiction is a relapsing, repeating, or recurring disorder. Individuals suffering from addiction engage in compulsive or uncontrollable drug seeking and drug use despite harmful consequences. Addiction is a brain disorder. Studies have shown that addiction involves changes in the way the brain functions in response to rewards, stress, and self-control. These brain changes can continue long after the individual stops using drugs. Addiction also involves genetics and the individual's environment and life experiences. CUD or SUD, cannabis use disorder or substance use disorder. Substance use disorder is addiction, and cannabis use disorder is a form of substance use disorder. It's the same definition as addiction, except for it's specifically for cannabis use disorder, that's CUD. And substance use disorder is a title for all forms of addiction. The incidence or frequency of cannabis use and cannabis use disorder. The Substance Abuse and Mental Health Services Administration's 2023 National Survey on Drug Use and Health reports that 61 million people aged 12 and older used cannabis in the last year. 29% of the nation's population used cannabis in the last year. 36.5% of adults aged 18 to 25 used cannabis in the past year. 20.8% of adults aged 26 and older used cannabis in the last year. 11.2% of adolescents ages 12 through 17 used cannabis in the last year. And 6.8% of people ages 12 and up had cannabis use disorder in the past year. Cannabis use disorder can develop in an individual when that person meets a set of criteria or when their cannabis use leads to significant problems and stress. These problems may include developing tolerance, experiencing symptoms of withdrawal after stopping the consumption of cannabis, cannabis cravings, neglecting responsibilities, continued use despite relationship issues, unsuccessful attempts to reduce cannabis usage, using cannabis in dangerous situations, and spending too much or excessive time obtaining and using cannabis. Studies have found it unclear what percentage of individuals go from cannabis use to cannabis use disorder. Some studies have found that 22% of individuals who use cannabis may develop CUD. Two risk factors of cannabis use disorder that are important are age and cannabinoid content and strength and potency of the cannabis. So the strength of cannabis, high potency THC, is a risk factor associated with the development of CUD. And individuals who begin cannabis consumption as teenagers or in adolescence have a higher risk of developing CUD. And let's go over some risk factors of CUD. Frequency. Daily use increases risk of CUD. Duration. Long-term use and lifetime use are associated with an increased risk of cannabinoid use disorder. Potency. Consuming high-potency cannabis increases the risk of developing CUD. Genetics. There are gene patterns that could lead to the development of cannabinoid use disorder. Comorbidity. The presence of other substance abuse disorders and or other mental disorders such as major depressive disorder increases the risk of developing CUD. And that concludes the section on dependency, addiction, substance use disorder, and cannabis use disorder. And now we will go over the dependency, addiction, SUD, and CUD quiz together. I'll give you a few seconds to review questions 1 through 4. Number 1. Select the components of addiction: recovery, reward, tolerance, readmittance, dependence, and withdrawal. The components of addiction are reward, tolerance, dependence, and withdrawal. Number 2. A simple definition of addiction is compulsive or uncontrollable drug use even though there are harmful consequences. True or false? True. Number 3. The reward system in our brain releases natural chemicals in our body when we engage in behaviors that are good for us or behaviors associated with surviving, for example, eating. True or false? True. Number 4. Substances can hijack your brain's reward system, interact with our brain's pleasure system, and force the release of natural chemicals, creating an association between the use of a substance with pleasure, reward, survival. This reward system hijacking can cause addiction. True or false? True. I'll give you a few seconds to review questions 5 through 9. Number 5. The purpose of the brain's reward system, pleasure center, is to boost and support survival behaviors. True or false? True. Tolerance is developed when you repeatedly take a substance. The brain and the pleasure center become less sensitive to the substance and begins to require more of the substance to produce the same effects. True or false? True. Number 7. Dependency on a substance is when your brain or body has become dependent on the substance or relies on the substance to function normally. True or false? True. Number 8. Developing dependency to a substance leads to withdrawal symptoms. True or false? True. Number 9. Withdrawal symptoms are a set of physical and mental responses that occur when chronic use of a substance is stopped or reduced. True or false? True. I'll give you a second to review questions 10 through 14. Number 10. Withdrawal symptoms are the brain's efforts to restore balance in the body in the absence of the substance the body has become dependent on. True or false? True. Number 11. Addiction is a brain disorder. Addiction is a chronic medical disease. Brain changes that occur from substance abuse continue long after the substance abuse ends. True or false? True. Number 12. Addiction involves genetics, the individual's environment, and the individual's life experiences. True or false? True. Number 13. Cannabis use disorder is substance abuse disorder specific to cannabis. True or false? True. Number 14. The strength of cannabis, high potency THC cannabis, is a risk factor associated with the development of cannabis use disorder. True or false? True. I'll give you a second to review questions 15 through 21. Number 15. Individuals who began cannabis consumption as teenagers or in adolescence have a higher risk of developing CUD. True or false? True. Number 16. CUD is present in both medical cannabis patients and adult use consumers. True or false? True. Number 17. Frequency or daily use of cannabis increases the risk of CUD. True or false? True. Number 18. Duration or long-term use and lifetime use of cannabis are associated with an increased risk of CUD. True or false? True. Number 19. Consuming high-potency cannabis increases the risk of developing CUD. True or false? True. Number 20. Genetics or gene patterns can lead to the development of CUD. True or false? True. Number 21. Comorbidity or the presence of other substance abuse disorders and or other mental disorders such as major depressive disorders increase the risk of developing CUD. True or false? True. Pregnancy-related risk. Fetal growth and birth outcomes. Baby's growth and birth outcomes. Using cannabis during pregnancy can result in a smaller than expected weight for the baby. This can lead to health problems. Prenatal cannabis exposure or consuming cannabis during pregnancy is linked to the increased risk of giving birth to an infant with a low birth weight. Cannabis consumption throughout pregnancy increases the risk of low birth weight. Preterm birth and small for gestational age. Early delivery or smaller size. Pregnant women who consume cannabis have a higher chance of giving birth too early. Babies exposed to cannabis in the womb may be smaller than babies who are not exposed to cannabis in the womb. Neurodevelopment effects. Child's brain development. Cognitive and behavioral impairments. Learning and behavior issues. Children whose mother consumed cannabis during pregnancy may experience or face challenges with learning, memory, and behavior as they grow. Prenatal cannabis exposure is linked to long-term neurodevelopment outcomes, issues with attention, memory, and problem solving. Children who were exposed to cannabis in the womb may also display behavioral issues. Pregnancy complications. Mother's health during pregnancy. Hypertension and other disorders. Consuming cannabis during pregnancy can increase the risk of developing high blood pressure. Hypertension or high blood pressure can be dangerous for both the mother and the fetus. Cannabis consumption during pregnancy is associated with an increased risk of hypertensive disorders such as preeclampsia. What is your opinion after reading some evidence on cannabis consumption and pregnancy? Driving impairment. Driving impairment. Consuming cannabis, specifically products containing THC, can impair the abilities needed to safely operate or drive a vehicle. These impaired driving abilities increase the chances of getting into a car accident. These impaired driving abilities include slower reaction times, reduced coordination, and poor decision making. Individuals who consume cannabis and drive may try to compensate for driving under the influence of cannabis in attempts to drive safely by driving more cautiously, slowing down, and keeping a greater distance from the vehicle in front of them. These measures may promote safety. However, slowing down, driving more cautious, and keeping a great distance from other vehicles is not good enough to counteract the danger of driving impaired. Module 2, Safety Practices for Cannabis Consumption. Mental health safety practices, cardiovascular safety practices, respiratory and pulmonary safety practices, dependency prevention, neurological and gastrointestinal safety practices, and pregnancy and driving safety practices. The first step to safe cannabis consumption is education and awareness. Taking this course is a great stride towards safe cannabis consumption. Gaining awareness about the risk associated with cannabis consumption and educating yourself on those risks can reduce misconceptions and stigma around cannabis consumption and help you to make safer choices. At the local, community, and state level, there are several precautions we can take to promote safe cannabis consumption and reduce the adverse mental health effects associated with cannabis consumption. Some of those precautions include public education and awareness, regulation and reduction of cannabis potency, screening health and monitoring health and cannabis consumption, restricting access to cannabis for vulnerable populations, training for healthcare providers and other medical professionals, and promoting research. Mental health safety practices. Delay start of cannabis use. To reduce the mental health risk associated with cannabis consumption, individuals can delay the start of cannabis use. The risk of developing psychosis and other mental health conditions is increased when cannabis consumption is initiated or started at a younger age. So starting cannabis use at an older age rather than an adolescent can reduce the chances of mental health problems. Limit frequency of use. To reduce the mental health risk associated with cannabis consumption, individuals can reduce and/or limit use. Lowering or limiting cannabis use can reduce the risk of developing these disorders. For example, make a consumption schedule that fits your consumption need and budget. Make your budget, decide how much cannabis medicine or products you need and can afford for the month. Then based on your need, dosage and frequency, and your budget, make a consumption schedule or timer. You can use the calendar and alarm clock on your smartphone and/or the materials provided in Module 3. For instance, as a patient, you will program or set a daily morning reminder of how many dosages you need for the day. Then you would set an alarm for the times of day each day of the week that you need to consume cannabis. Follow the schedule to ensure that you are not exceeding limits that put you at risk. Choose lower potency products. To reduce the mental health risk associated with cannabis consumption, individuals can choose lower potency products. High potency, specifically high potency THC cannabis, is linked to an increased risk for psychosis and other mental health disorders. Choosing to consume more low THC cannabis, cannabis medicine, and cannabis products can help to prevent developing a mental disorder. Be aware of personal and family mental history. To reduce the mental health risk associated with cannabis consumption, individuals can investigate and uncover their own personal and family mental health history. Individuals who have a personal or family mental health history of disorders like schizophrenia have a higher risk of harmful effects from cannabis consumption. To promote the prevention of potential adverse effects or to prevent exacerbating or making worse any present or potential mental health disorder, individuals with a personal and family history of any mental health disorder should proceed with caution when consuming cannabis. Avoid mixing substances. To reduce the mental health risk associated with cannabis consumption, individuals can avoid mixing or taking multiple substances. Taking other substances such as alcohol when consuming cannabis can exacerbate or make worse mental health and mental health conditions and produce other unpredictable effects. Seek professional guidance. To reduce the mental health risk associated with cannabis consumption, individuals can seek the guidance of a health professional, mental health professional, or a cannabis medicine professional. Getting advice from a medical professional can help individuals make better informed decisions and reduce potential mental health risk. Consulting a healthcare professional to discuss your health and cannabis consumption can help you understand your health and understand and reduce specific risk and mental health risk associated with consuming cannabis. Note: this may be challenging given the landscape of medical cannabis. There are resources at the end of this course that can help patients talk with their physicians and find professionals to help them better and safely navigate medical cannabis consumption and cannabis consumption in general. Consider integrative approaches. To reduce the mental health risk associated with cannabis consumption, individuals can seek other health practices to increase the effects desired from consuming cannabis, i.e., medical pain relief or recreational relaxation, to increase the effects desired from cannabis without consuming cannabis. For example, massage therapy. Utilize sources like the Cannabis Health Index. To reduce the mental health risk associated with cannabis consumption, individuals can utilize sources and materials that encourage and promote practices to enhance optimal health and health practices to pair with cannabis consumption. The CHI, the Cannabis Health Index, is a comprehensive resource book that summarizes the results of scientific studies and provides a clear, evidence-based set of guidelines and approaches to aid its reader to make better informed decisions about cannabis as a health treatment. Cardiovascular safety practices. Limit frequency and quantity of use. Use less cannabis less often. Consuming cannabis frequently and consuming large amounts of cannabis can increase the risk of heart problems. Reducing how often you consume cannabis and how much cannabis you consume can reduce cardiovascular risk and promote healthier hearts. Choose products with a lower THC content. Consumption of high-potency THC cannabis products is associated with harmful cardiovascular outcomes. Consuming cannabis products with a lower THC concentration can reduce both acute and chronic harmful cardiovascular effects. Avoid smoking cannabis. Smoking cannabis, like smoking tobacco, allows carcinogens and harmful toxins that can harm the heart and negatively affect cardiovascular health to enter the body. Consuming cannabis in non-combustible forms such as vaping or edibles can reduce the cardiovascular risk associated with smoking cannabis. Edibles and vaporizers may be gentler on your heart. Screen for cardiovascular conditions. Check your heart health. Individuals with heart issues or hypertension must proceed with caution. Cannabis can worsen high blood pressure and heart issues. Check your heart health before deciding to consume cannabis regularly. Talk with your doctor or healthcare professional. Keeping an open dialogue, open conversation with your doctor about your cannabis consumption can lead to specific interventions and advice crafted for your health journey by you and your doctor. Allowing your doctor to know about your cannabis consumption helps them to better make choices about your health and take it into account issues such as a drug interaction, etc. Learn symptoms and warning signs. Watch for adverse symptoms. Pay attention to the effects of cannabis consumption. Pay attention to what you experience or how you feel when you're consuming cannabis. Learn the symptoms of a heart attack or cardiovascular distress. Stop consumption and seek medical help if during cannabis consumption you become dizzy, experience shortness of breath, or chest pains. Respiratory and pulmonary safety practices. Try alternative or other non-combustion, non-smoking routes of administration or methods of consumption. Vaping cannabis or the vaporization of cannabis heats cannabis in a manner that allows the release of cannabinoids without combustion, fire, and smoke. Vaping cannabis is associated with less adverse harmful respiratory symptoms compared to smoking. Ingesting cannabis orally, applying topical solutions to the skin, or taking cannabis via a depository eliminates respiratory exposure and exposure to dangerous, harmful substances such as tar and carcinogens found in smoke. Reducing or avoiding deep smoking and inhaling practices. Breathing or inhaling normally when smoking cannabis can reduce the volume or amount of harmful substances stuck to the lungs. Taking deep inhales or deep breaths and breath holding or holding cannabis smoke in can cause more harmful substances to stick to your lungs and exacerbate respiratory issues. Verify and ensure quality and purity of product. Consuming cannabis from trusted, legal, reputable sources that follow safety standards can reduce exposures to contaminants that can trigger respiratory issues. Illegally purchased cannabis or cannabis that is not purchased from a state licensed dispensary has a great chance of containing various contaminants. Dangerous substances such as heavy metals, mold, pesticides, etc., that can increase respiratory risk and have damaging effects on your overall health. Routine and regular health monitoring. Routine or regular checkup visits and consultations with your doctor can help uncover or detect possible respiratory or lung issues associated with smoking cannabis early. Your doctor can also provide advice to lower risk and how to consume cannabis more safely. Awareness of potential respiratory risk. Having the knowledge that cannabis consumption, smoking can lead to respiratory issues can foster or encourage safer consumption practices. Integrative health approaches. Using integrative health methods and practices like mindfulness or meditation and stress reduction and stress relief techniques can help you manage your condition without needing cannabis, with utilizing a reduced amount of cannabis, or without relying on inhaling or smoking cannabis. Dependency prevention. Preventing cannabis use disorder involves reducing the initiation or start of problematic cannabis use and reducing the progression or continuing of problematic cannabis use. Dependency prevention focuses on altering your cannabis consumption behaviors to avoid the development of cannabis use disorder. Public education and awareness. Evidence-based information about the potential risk or harmful effects associated with cannabis consumption can influence public perception and help reduce usage rates. Understanding the risk of cannabis consumption can help patients or adult use consumers make safer choices and avoid the start of and progression, continuing of risky or harmful consumption practices that may lead to the development of cannabis use disorder. Screening and early detection. Routine screening allows for early detection of risky consumption behaviors. Utilizing interviews and other interventions or approaches can help reduce risky cannabis use and cannabis use in general among young adults and adolescents. Routine visits, examinations, and conversations with your doctor can reveal symptoms that can indicate risk for cannabis use disorder. Regular communication with your doctor and regular checkups can help the doctor identify risk levels and help you navigate your cannabis consumption to avoid starting or continuing risky or harmful cannabis consumption practices. Promotion of alternative coping mechanisms. Finding alternative and other healthy ways to address some of the symptoms or conditions you address or treat with cannabis or reasons you consume cannabis reduces your cannabis consumption and your risk for cannabis use disorder. Avoiding consuming cannabis when bored or stressed and finding alternative or other ways to address or deal with boredom or stress, for example, spending time with family or friends or taking a walk or run or jog, can reduce your cannabis consumption and encourage healthy consumption behaviors that lead to decreased risk for cannabis use disorder. Access to treatment services. Individuals struggling with cannabis dependency or cannabis use disorder have a better chance at full recovery or quitting consumption when treatments such as cognitive behavioral therapy or support groups are available and easy to get. Having access to treatment or being able to get treatment or professional help for dependency and cannabis use disorder increases the chances of recovery or quitting. Neurological and gastrointestinal safety practices. Neurological effects. Dose control, the amount of cannabis you use. Start low and go slow. To minimize harmful neurological effects, start with the low cannabis dose and slowly and gradually increase that dose as needed. THC content. Choose products with lower THC content. To minimize harmful neurological effects, choose cannabis products with the lower THC content. High-risk population and avoidance. Proceed cautiously and with awareness if you have a mental health condition. You must understand and know if you are a patient or adult use consumer that falls into the group of people who have a higher risk for adverse neurological effects associated with your cannabis consumption. Individuals who are at high risk for neurological effects, for example, individuals diagnosed with certain psychiatric disorders, must consider avoiding cannabis or THC-heavy cannabis products. Gastrointestinal effects. Learn and recognize the symptoms of the gastrointestinal disorder associated with cannabis consumption, CHS. Recognizing the early signs of CHS allows for early intervention and treatment that helps to prevent the condition from further developing. Pregnancy and driving safety practices. Avoid cannabis use during pregnancy. Avoid cannabis use during pregnancy. Stop smoking cannabis or consume cannabis in non-combustible forms, for example, cannabis tea. Avoid THC or high content or potency THC. The best choice you can make to ensure a safe and healthy pregnancy is to avoid consuming cannabis and consult your doctor, a cannabis nurse, or a cannabis doula. The consensus about the safety of consuming cannabis during pregnancy is conflicting culturally. There's a community of doulas and cannabis healers that utilize cannabis medicine in birthing and for patients who suffer with extreme nausea and morning sickness. However, scientists have reported adverse, harmful effects associated with cannabis consumption during pregnancy. The best policy and the best choice you can make to ensure a safe and healthy pregnancy is to avoid consuming cannabis. However, if you are a person who is considering utilizing cannabis in the popular cultural way, then you must consult your doctor, a cannabis nurse, or a cannabis doula on how to proceed. And the best policy is to follow the evidence and avoid cannabis during pregnancy. Protecting children and pets. Safe storage. To protect adults, children, and pets from unintentional and accidental ingestion, it's simple. Label cannabis products. Safely store cannabis products in locked boxes, locked cabinets, etc. Inform adults living in and visiting your home that cannabis products are stored in your home. Avoid driving after consuming cannabis. To minimize the adverse harmful effects of cannabis consumption on driving, do not consume cannabis and drive. When smoking or vaping cannabis, give yourself 2 to 4 hours after consumption before you drive. When consuming cannabis, THC concentrates, or liquid or solid edibles, do not drive after consumption. Designate a driver or consume at home or in a place you don't have to leave for several hours. And that brings us to Module 3, Cannabis Consumption Tracker Journal. Here's where we'll apply our knowledge of both the risk and the safety practices, and we'll combine that with our personal history and our cannabis consumption. We'll track ourselves between 2 to 3 weeks, and then we'll make a consumption schedule that we'll adhere to, that would enforce our personalized schedule. It will enforce our own consumption safety. So the Cannabis Consumption Tracker Journal includes a personal health history, cannabis consumption history, a current health status, and then you have a daily consumption log to complete, a weekly consumption log on frequency, a weekly consumption log on potency, a weekly consumption reflection, and then you complete the cannabis use disorder self assessment, and then you set out your consumption goals on a schedule, on a calendar. So this is what the personal history section of the journal looks like. And you record all this information. It's for your personal use, and you can utilize it with your medical professional, your doctor, or any cannabis medical professional that you may have access to. So the personal health history asks you to list your diagnosed conditions, number of surgeries, hospitalizations, allergies, past medications, the dosage of that medication, and the condition that medication was prescribed for, your mental health conditions and diagnosis, and then it asks about the history of your parents and your grandparents and your aunts and uncles. It asks you, have you been exposed to any of these disorders that are exacerbated or made worse, or you have a higher risk from by being genetically exposed when consuming cannabis. Then it asks you about your cannabis consumption. What age did you begin consuming cannabis? How long have you been consuming cannabis? Do you take breaks or tolerance breaks from cannabis? Do you consume cannabis every day? And these questions are all geared to also gauge your level of risk to a number of conditions. As we can remember from the course, that starting cannabis consumption in adolescence or a young age increases your risk for certain conditions, and that long term cannabis consumption also increases your risk for certain conditions, and that taking breaks from cannabis can reduce your tolerance, and that building up a tolerance to cannabis is a pathway to CUD. Okay, and then it asks your purpose of consumption. Are you a patient? It asks your status of consumption. Are you a patient or are you a recreational adult user? What are you treating and why do you consume? It also asks what route of administration, how do you normally consume cannabis? And it also asks a very important question. Are you consuming high potency THC cannabis every time you consume? Because as we learn from the course, high potency THC is also a factor that contributes to increasing your risk for particular conditions and effects. Then it asks about your current health status. It asks a big question. What recent events or symptoms led you to this course or consumption tracker? So why have you decided to get this information on this knowledge about the risk and safety precautions associated with cannabis consumption, or why are you using this tracker? And then it goes on to ask you about your mental health, your current health status as far as your mental health, your heart health, your stomach health, the health of your brain and nervous system, and your lung health. And then we move on to the daily consumption log. And you will use the daily consumption log for frequency and potency. You will use it for each time that you consume. So you will make the time and date, and you would choose the purpose of consumption. So here's an example. Let's say that you are a medical person. But this purpose of consumption at this time, you're consuming, it's a Saturday, and you have already did all your scheduled consumptions for your conditions that you treat with cannabis, and now you are using cannabis recreationally, and so you market as that. Or that can be, or it can be vice versa. You can be a person that is a recreational user, and you just so happen to be recording a daily consumption log about the time you use cannabis to kill the pain in your ankle when you bump your ankle, right? So you had a medical consumption. You consume this cannabis for pain relief. So, okay, you will write down the purpose of consumption, the consumption method, inhalation, ingestion, topical. You will write down the product type. Was it flower, a vape cartridge, or concentrated THC product, a gummy, a chocolate, a candy, a beverage, a tincture, and so forth, or something else or other. You will write the dosage, milligrams or grams. You will write the percentage of THC and CBD cannabinoids. You will also write down the percentages of other cannabinoids. If you took flower, you would write down the flower strand and the flower brand. If you took another product, you would write down the name of that product and the product brand. Also, on the daily consumption log, you would record the status before consumption. You would rate how you felt. You would write what you were doing and planning to do before consumption, and then you would rate how you felt before consumption on a scale of 0 to 10 on the different dimensions: happy, relaxed, focused, and so forth. And then you would do the same, a variation of this, status after consumption. You would list immediate effects that come to mind. Then you will rate how you feel on a scale of 0 to 10 on these different dimensions: physical and mental. And then you would list the effects after consumption, some more details about how you feel. And you would decide, how did you benefit from this consumption? What did you get? Did you get to relieve some pain? Did you reduce some stress? Did you induce some focus so that you can accomplish a creative task, or do, pay attention to something, and so forth? Whatever benefit you think you may have, that you have got from this consumption. You list the side effects and concerns, and there's also spaces on the status before consumption and status after consumption for notes. And now you complete your weekly consumption log on frequency. So you collect your daily consumption logs for the week, and you take the information. Let's say you consumed at 1:30 p.m. on Sunday. You would take the information, you would write 1:30 in the 1 p.m. box, and so forth for all the times and days that you consume. And then you will have your entire week plotted out in this box, so you can see how many days a week you consume and how many times per day did you consume. And then you would also be able to answer the question at the bottom of the calendar: is there a day, a time, or a day and time that you consume the most? And if you answer yes to that question, then you would contemplate and answer this question: is there a reason or a schedule for this consumption? And this is all to enforce conscious and safe consumption behaviors. And then you would fill out your weekly consumption log on potency in the same way. But what you will be looking at on this calendar is the number of days you consume high potency THC and the average number of times you consume high potency THC cannabis per day. So let's say on Monday you consume cannabis 4 times. and 2 of those times were high potency. And let's say you did that same schedule 3 days this week, so you have 3 days out of the week you consume high potency cannabis, and the average amount of days you consume, average amount of times you consume high potency per day would be 2. And then you would answer the question, is there a day or time that you consume high potency THC cannabis the most? You would look on your graph and see if you have a pattern, and you would answer the question. If you answer the question yes, you will answer, what is the reason or schedule for this high potency THC cannabis? Is it because you need it? Is the dosage for your condition? What's going on? Why are you continuously consuming this high potency THC cannabis? Is what you would write down in your journal for yourself to understand and examine. And then you will move on to a deeper reflection. How did your consumption impact you this week? Did you notice any negative physical, mental, or psychological effects? What can you do to improve your consumption experience? Right? And so this reflection, this weekly reflection, it would involve you reviewing the course, reviewing the risks, reviewing the safety precautions, or even seeking out consultation from your doctor or other medical professionals, or seeking out more information. And once you've done all of that, you can follow this link and assess yourself for cannabis use disorder and record your score here. So here's what the cannabis use disorder identification test, cut it, looks like. This is the tool that you can use every week to monitor your risk level for cannabis use disorder. So you begin to cut it by answering the questions. Have you used any cannabis over the past 6 months? And if the answer is yes, you move on to the questions in the boxes. How often do you use cannabis? And you answer 0, never, 1, monthly or less, 2, 2 to 4 times a month, and 2, 3 times a week, and 4, 4 times a week. And you go down and you do that for each question, and you get your score. So the questions are, how often do you use cannabis? How many hours were you stoned on a typical day when you had been using cannabis? How often during the past 6 months did you find that you were not able to stop using cannabis? How often during the past 6 months did you fail to do what was normally expected from you because of using cannabis? How often in the past 6 months have you devoted a great deal of your time to getting, using, or recovering from cannabis? How often in the past 6 months have you had a problem with your memory or concentration after using cannabis? How often do you use cannabis in situations that could be physically hazardous, such as driving, operating machinery, or caring for children? Have you ever thought about cutting down or stopping your use of cannabis? And once you answer all those questions, you will add up your scores. You will add up your score, and a score of 8 or more indicates hazardous cannabis use, while scores of 12 or more indicate a possible cannabis use disorder for which further intervention may be required. And once you have completed your journal, all of your history and all of your questions, and you've done 2 to 3 weeks of tracking, then you can use all of the sources from the course and all of your sources, all of your resources, your medical professional, and all of the other resources that you utilize. And I've added resources at the end of the course that you can also utilize. And you make yourself a consumption schedule, or you make consumption goals. You choose the best dates and the best times using the information you recorded and collected in this journal and the information in the Cannabis Consumption Risk and Safety Practices course. Map out the best and safest consumption goals for yourself on this calendar. Include potency and product type. Set your schedule by adding the potency and product type on the appropriate days and times. Thank you and good luck. Here are some resources. The first link is to the Cannabis Consumption Risk and Safety Practices course and the Cannabis Consumption Tracker Journal. The second link is to Americans for Safe Access. They have lots and lots of information. They have lots of tools to help you navigate your consumption and navigate conversations and interactions with your doctors and medical professionals. Normal. They have lots of information on advocacy and policy. Associations of the Association of Cannabinoid Specialists. They have lots of courses and lots of information on the science of cannabinoids and so forth. And the Cannabis Doula. It is a resource that I want to give out because of the sensitivity of the discussion on pregnancy related risk. Culturally, people are utilizing cannabis in a different way than what research suggests. And if you are a patient or recreation, if you are a pregnant patient, who needs help navigating and understanding the research and what's in the cultural underpinnings, then this website is an awesome resource for you. Thank you again.